let's be honest. We all think we're super smart. We think we know it all. So when the doctor says something to us in an appointment and we don't understand what it is, we just kind of go with the punches. We're like, hey, you know what? I'm not even going to ask the question because I don't want to look silly. Our next guest says, you know what? No, ask the questions, talk to your doctor, be willing to say, yes, I don't know what you're saying. Help me. Dr. Jeff Moroski. He is the Chief Medical Officer of SilverSummit Healthplan. He's helping people get right when it comes to their health aptitude. How are you, sir?
I'm great. That's a wonderful point. Unfortunately, I spent 12 years of my life learning how to talk in a way that nobody else understands. So it's really important that we address this issue and help all patients really kind of feel it's okay to ask the questions, understand that there's a lot of lingo in healthcare, and really kind of then you can be empowered to decide what's best for you.
Yeah, there's health literacy is so important, and I think there's one of two ways you can go about it. Either one, you'll get the information, it'll go in one ear, out the other, you don't do anything about it. Or two, you think you know so much more that you Google your way to answers that are not
Yeah.
true. So that's not a good thing as
Yeah.
well. It's so important
Yeah.
because ultimately you want people to be empowered with as much knowledge about their health situation as possible.
Yeah, we do. And I don't want you to have to Google your way through it. And no doctor does, no healthcare provider wants you to do that. We want you to feel like, hey, it's okay. I didn't understand that word. Hey, slow down. Unfortunately, for physicians, there's some really good studies that have been done that show that we can last about 7 seconds before interrupting patients. So,
Wow.
ask us questions. Yeah, we just want to move on to all the problems. And
Yeah.
so, it's really good to feel okay to say, hey, I don't understand that. What's a colonoscopy? That's not exactly a word that, comes with its own meaning. We even think about mammograms, right? We talk about them, but not everyone knows what that means. Or hypertension's high blood pressure. We came up with a funny word for everything. Heart failure. We make them up.
Yeah.
And so we want to make sure you're comfortable in that space, right? If you know your own health history, you do better, right? If you know what's happened to you, you can help me decide what I can do to help make things better. You really want to be able to ask that question, right? Interrupt me if necessary,
Yeah,
and,
well,
and just
if
ask.
you're able to communicate in a way that we understand, the next time we're in front of another health professional, we'll be able to communicate to them exactly what was communicated back to us, which is, I mean, I'm assuming this is a relatively major issue. This is something that kind of is persistent and it results in worse results health wise.
Yeah, the lower the level of health literacy, like the less you understand about your own healthcare, the worse the outcomes are for you in chronic diseases, in preventative medicine, like all those things you need to do. If we don't talk to you about your vaccines, you go and Google it, and that's not always the best thing for you. I always tell people, we're a great resource. When you see ads on TV for drugs, they have every side effect on the planet listed. That's
Yeah,
just the way the legal does things. But if you come in and have a conversation with your physician, you're going to get the information that's right for you to
yeah.
help you make the choice that's best for you and for your family.
So how
And
can we?
so, we recognize that we're part of the problem, and
Yeah,
you need to help us by asking questions.
how can we improve our health literacy other than getting a doctorate? That's not on my
Yeah,
list of things to do.
you know, no, don't go to med school, please. I think the best way, the easiest way to do it is first just understand what's happened to you in the past, even in layman's terms, right? I had my gallbladder taken out. I did. But that's not cholecystectomy, which is the medical term. Just know your own history in your own words. You want to also ask the questions of your doctors. Hey, what's next for me? What's right for me? I don't understand what you just said. All really valid. And insist that we don't use jargon or funny words. Just say, hey, keep it where I understand it. And that's really important. And just don't forget to ask and ask often.
Yeah. Just say to your doctor in English, please. Is that possible?
Hmm.
Or
Yeah.
whatever your language
In
is,
English
frankly.
or in
Yeah,
Spanish or in
exactly.
Tagalog or whatever works for you. We got to find a way to do that.
Sometimes,
You know,
if it was in Greek, I might understand it better than the actual terms
yeah,
you're using.
yeah.
Dr. Jeff, it's great seeing you as always. You're one of my favorites, and it's great to talk to you, my friend.
Great to talk to you too. It's National Immunization Month. Don't forget about all your immunizations this month. So please, get out there and get vaccinated. Flu,
Absolutely.
COVID,
Everything
tetanus,
under
you
the
name it.
sun. It's what helps us stay a healthy populace. SilverSummitHealthplan.com if you want to learn more about Silver Summit Health Plan. Dr. Jeff Moroski, a part of it, and frankly, that makes Silver Summit look really good.